We don't know when you walk down the street who's got insurance and who doesn't, who's got health care and who doesn't. We call them the working poor, but they're working people who don't make enough money or don't work at a job where they've got insurance.
They're struggling to get by. They're choosing every day, do I want to buy a meal or buy health insurance?
I have a patient who has horrible high blood pressure. She had to make a choice between food and the blood pressure medicines. She decided food. The blood pressure eventually resulted in a carotid dissection, leaving her with the inability to speak. She can no longer use the right side of her body. And had Volunteers in Medicine been available at that time, and had she used the clinic, it would have been prevented.
The idea is for the community to look after its own, since both the federal and states has failed to deliver the needy coverage for the people.
A patient who comes to our clinic will have access to services available free of charge, disease management for chronic disease and acute disease, pharmaceutical or medications, dental care, psychological counseling, pediatric care, diagnostic lab and radiology studies, hospitalizations if necessary, and health education.
The Volunteers in Medicine Clinic is going to give people a chance to get out in front of their disease, to learn how to prevent diabetes, how to deal with obesity, how to stop smoking.
We're providing staff, we're providing space, we're doing the ancillary testing. If someone needs a surgery, that'll be done at the hospital free of charge for these patients. So our commitment is substantial.
The tangible result in this program is that we're going to have a clinic that's available to everyone who's underserved in our community to help take care of them, their health care needs, and to prevent chronic problems from becoming worse, and to have a healthier community all the way around.
Physicians have always seen patients that don't have resources to pay, but their ability to do that is limited in their private practices. The hospital has always taken care of those patients through the emergency department or through the CHAP program.
They've given me physicals, tests. They helped me go through a leg operation with the Bloomington Hospital, and they've helped me found out I had diabetes and I had high blood pressure, and they found all of that.
So by partnering with the community in this effort, like the Volunteers in Medicine program allows us to do, we hope that we're able to reach a lot more people and provide those services to many more people.
We have two groups of volunteers. The medical professional, start from the MDs, to the dentists, to the nurse practitioners, to the social workers, to the psychologists, to the dietitian, to the nurses. We have the lay volunteers, which they cover greeters, paperwork, calling for appointment, a follow-up for appointments, help in shores, and the most important going to be educator to help us establish a system of education, of wellness.
And I think everyone knows a healthier community is going to be a better community, a more productive community, and probably in the long run a more cost-effective community. People will be getting care in the appropriate place at the appropriate time, and hopefully in the long run they'll require less care.
The logo with the heart and the hand, to me, means that health care should be delivered within a realm of a culture of caring, which is what the Volunteers in Medicine is trying to accomplish. In other words, health care should be delivered, 1, free of charge, 2, with dignity towards the patient, and 3, with the idea that all patients in the community have value.
If there was any way I could thank the clinic for getting me through this hard situation, there is not enough I could say about the clinic or the hospital that would not be true. They've been wonderful to me.